welcome to the Fertility Conversations podcast. The goal of this podcast is to create more awareness about infertility and to provide support to people trying to conceive. Thank you for listening today, and we hope you will be encouraged. And now, here is your host, Ola.
Welcome to another episode of Fertility Conversations. Today we are joined by Dr. Ogunkinle of Origene Fertility Clinic in Lagos, Nigeria. He joins us again to speak about fertility. Today we are focusing on fertility preservation. So welcome, Dr. Ogunkinle, and thank you so much for joining us today.
Oh, good evening, Toke, and good evening, all the listeners from all over the world. So it's my pleasure to be with you this evening.
Thank you for joining us again. Yeah. So to start off, please tell us a little bit about yourself and your role at Origene Fertility Clinic.
Okay. Like you rightly said, my name is Dr. Babatunde Ogunkinle. I'm a consultant, gynecologist, fertility specialist, and medical director at Origene Fertility. Origene Fertility, we partner with couples who, to fulfill their dreams of becoming parents, we offer varieties of assisted reproductive technique, which includes intrauterine insemination, in vitro fertilization, which has many parts to it, like donor gametes, sperm donation. We do pre-implantation genetic testing for aneuploidy and monogenic disorder. We also offer cryopreservation services for varieties of people and varieties of reasons. So, for various reasons. So, well, Origene Fertility is at Ikoyi in Lagos, Nigeria.
Wonderful.
Yeah.
Thank you for sharing. That sounds really extensive, the level of service that you do have available. So like I said earlier, I know that today you're educating us. Last time we spoke about impact of age on our fertility. And today we wanted to speak further about that and move into fertility preservation. So you wanted to educate us about that. For anyone listening, what do we need to know? And what is fertility preservation really?
Yes, fertility preservation, when we begin to recognize infertility as a disease, well, some of us will call it that maybe infertility is a need, but I think globally it's being recognized as a disease now. So,
yes.
And it is important to prevent any disease, just like you're going to take vaccination for COVID, for common cold, flu shot and all. So we begin to look at infertility, the preventive measures in infertility to avoid unintended childlessness in future. I know preservation started with sperm. I think the first, sperm freezing was the first thing to take place. I think that was in the 1950s. And I think about 25 years later, that was when we started freezing embryos. Then later, oocyte eggs. The freezing started some years later. And with the oocyte freezing, I think the first child birth from oocyte freezing was in the, I think, 1986, thereabout, and it was done by a doctor in Singapore. But basically, for freezing, for fertility preservation, initially was like the essential preservation, essential in the sense that people who will undergo certain medical condition that will predispose them to infertility in future, most especially the people undergoing cancer treatment, either through radiation therapy or through chemotherapy, that is use of medication, because most of the medications are not friendly to the gametes, sperm, eggs, ovary, testes, they're not friendly. So as a result of that, just before they start their therapy, since they are still considering future fertility, they're encouraged to freeze their sperm, freeze eggs, especially for those ones that are not, obviously, it's the women who are not married that will freeze eggs. Then some years later, we get into the, we got into the part of social oocyte freezing for various reasons. People who are after their career, not ready for to settle down, to have a family yet, or women who even they are ready, but there's no suitable partner, whether they've experienced terrible relationships with their male partner, they may decide to freeze their outside in future, hoping that they will meet somebody that is suitable for them. So basically, those are the indications for um, preservation. It's just to prevent fertility. So infertility. So one can view fertility preservation as kind of reproductive insurance.
Right. So, that's how we started, and that's where we are at right now. The fact that now we have social freezing, and in some cases it had been done because of perhaps medical conditions that people were dealing with. But in terms of social freezing, and just thinking that perhaps in the future people might choose to get married, or they might choose to become single parents, whatever the case might be, them choosing to preserve their fertility. Is this something that women and men, perhaps in universities and colleges, do we all need to start getting our fertility tested and then preserving our fertility for the future? Should we all be doing this? Should this be for
No,
everyone?
I won't say should be college dependent, but I think it should be age dependent. Once you get to a particular age, that you feel that you're becoming conscious of the fact that you want to start a family, but for some reasons, or you want to have a family in future, and for some reasons you think that there may be delay in that path, then those are the people that should come to freeze. And the earlier the decision is made, the better for them, because once it is delayed, then the chance of having that family in future also diminishes significantly.
Right. So what age is that then?
So, okay, let's talk about sperm. What with sperm is not freezing, preserving sperm is not as it's not as laborious, it's not as time consuming or
Mm-hmm.
tasking like preserving eggs. And by the way, it's not only sperm that one can preserve uh, for a man. We can also preserve testicular tissue
Oh,
for the man. Yes, just like we can also preserve ovarian tissue for women, um, especially young female child. One can preserve ovarian tissue and later transplant back into the patient.
right.
So for sperm freezing, what is done after appropriate counseling, the discussion that they need to have, which will be financing, probability of recovery in future, and what needs to be done. So in terms of and some test, obviously the man will need to do semen analysis
Right.
first to determine whether there's even sperm in the ejaculate. And once there's sperm in the ejaculate, and after appropriate counseling, sperm can be frozen and stored for as long as possible. Because in Nigeria, as of now, we don't have a cap
Okay. That's good.
when unused garments should be disposed of. There's no regulation as of now, like in some countries like UK, I think there's a cap in the UK that you can't freeze your garment beyond, I think, 10 years. But
Yeah, it was. They changed it.
yes, I believe that it's being reviewed, especially after COVID, and a lot of people are
Hmm.
coming forward contesting such regulation. At least one should be able to have right, not government,
Exactly.
on their own garment. Now, going back to oocyte, the oocyte freezing,
Which is
the
eggs.
yes, the eggs freezing. I think we should use eggs.
Yeah. Yeah.
I think yes, I think we should use eggs so that we can connect with our audience
Right.
more than oocyte. I think oocyte is a bit technical. So for egg freezing, number one, why age is very important. The younger the person is, the fewer the number of eggs that will be required to store to achieve that future family desire. The older the person gets, the more the number of eggs, and also the lower the chance of achieving that. Because the younger eggs are likely to thaw out well uh, when it's going to be used compared to older eggs from the older women. And there's a study that this was done in 2013. Maybe there has been some improvement over the years anyway, but this particular study is that after 3 cycles, a woman who froze her egg at 25 has 31.5% chance of having a live birth compared to somebody who froze her egg at 40, with 14.8% chance. And the reason is because egg quality attrition rate is higher with in older age group.
Right.
When yes, sometimes it may actually be better for these old women. And these are the discussions that should be held by the physician when a patient comes forward that he wants to freeze eggs, because the expectation is knowledge is different, which may shape their expectation. So it's the role of the physician to put everything on the table that you probably require more number of eggs, and also to let them know that it's not a fail-safe insurance. So that discussion should include the procedure itself, risk associated with the procedures, the number of times that the woman would have to undergo that procedure of um, egg recovery, the financial implication of that, the chance of live birth after in future when it's going to be used to when I attempt to have a child, and the probability of usage of such garment. And sometimes one has to discuss the posthumous utilization of such garments, especially people who are undergoing cancer treatment. Yes, we hope they survive, but what if they don't survive? Even in other people doing social egg freezing, life can happen.
Right.
So that discussion must be had that in event of death, what should happen to this garment, or in event of non-usage, what should we do to their garment? Who should have right among their relatives?
Right.
These are the discussions that should be held. And why age is also important. You can imagine somebody who is just 25 and is concerned about a partner not finding a suitable partner. And at 25, it's not the same as when you're 37. So the probability, there's still a good chance that she might meet somebody before she turns 35. And under 30, the first thing is to try naturally.
Right.
And at that age, the probability of pregnancy is still high. So what would happen to the eggs that have been
Frozen.
frozen?
Right.
So, I mean, it's not to say don't do or do. It's to just stimulate some thinking that can also shape their decision.
Yeah. Which is very important, because sometimes people do, like you said, if someone passes away, which we had conversations about that, when people start fighting about what happens to the person's sperm. Can the wife or partner use it? Can they not? What happens
Yes,
to the embryos? And even if people break up. So it's important to have those conversations and to have everything documented properly.
yes, exactly. One aspect, then for in a way we talked about sperm freezing. I think the only thing that is difficult for men in terms of getting their tissue is when if one wants to do testicular tissue freezing, because that involves some surgery. But there's no way around that of egg freezing. There is surgery, and is intense, it's more laborious. It's going to restrict their movement for the period, because during monitoring you cannot go away for a long time.
Right.
I can't leave the immediate environment. So it requires a bit of dedication, and that person has to be intentional about it. And also there can be some accompanying emotional roller coaster, in the sense that if she's not responding well to stimulation. So let's briefly go through what, apart from, because I mean everything starts with consultation, whether for social freezing or for medical reasons. Because the first thing is to have consultation and evaluate the woman. Evaluation means that, okay, general health, then the ovarian reserve, especially because the ovarian reserve will help the doctor to manage the expectation of the particular woman, also be able to prescribe the appropriate dose for stimulation. So an investigation may be a transvaginal scan for antral follicle count, serum anti-malarial hormone to estimate. Some people combine the two. I like to combine the two, because for their sensitivity and in terms of predicting response.
Right.
So then the medication used is just like in IVF. The only difference between egg freezing procedure and the proper IVF is that there is no attempt to fertilize the egg. So egg freezing stops at egg retrieval.
Right.
So the first is after evaluation and appropriate counseling discussion. So medication start. Medication are usually in injections. We advise patient to administer the injection themselves, so that they can have control over over their treatment, and in a way it also helps them in how would I put it? Should I say um, in a way it puts them in proper involvement. It's not,
Right.
I mean, doing it themselves, so they know that they are 100% involved in doing it. But of course, if they have a partner who can help them, be a friend, or I mean, it's possible to have a partner and not wanting to start a family yet. Probably, in some countries you cannot, you can freeze eggs, but you can't freeze embryos. So it depends on the law of that country. So they may decide to do so. A partner can also help in administering the injection. Of course, they come for monitoring, which is also ultrasound based and blood test occasionally. And once follicles are mature, they come for egg retrieval. The process of egg retrieval is actually, average time is about 30 minutes for the actual procedure itself. But for observation after surgery and before discharge, maybe they spend like 2 hours in the clinic, depends on the kind of anesthesia that is used for the procedure. And of course, we will warn patients about the risk of ovarian hyperstimulation syndrome, which is a major risk for stimulation. But now things are better. Things are better in the sense that there are protocols that are suitable for oocyte freezing, people who are not going to have embryo transfer, and such protocol reduces the risk of ovarian hyperstimulation syndrome significantly. So,
okay. Okay, so you were saying that with ovarian reserve, you use both the test AMH blood test and an ultrasound to confirm the ovarian reserve. So going back to my question earlier, then, should we all be getting tested? Because as a woman, if you don't get your ovarian reserve checked, you're not going to know what the situation is, if you have a whole lot of eggs left in your ovarian reserve or not. And as a man, you're not going to know if your sperm is okay or not unless you get sperm analysis done. So at some point, perhaps the reason why I noted college or university earlier was just because I thought, well, perhaps late or early 20s, at some point, should we be getting tested anyway, just to know what the situation is and if we need to preserve our fertility or not?
You know, what the way I'm going to answer that question is number one, to just create awareness. And testing should be individualized based on the person. Anybody who want to, I mean, at any point in time that you get worried about your fertility, I would say you should test, because in both men and women, I would say infertility is stealth, because it's going on and you don't even know.
Right.
Until you do the test to expose whether you are infertile or fertile. And you know, sometimes the test is also not a predictor of future fertility, in quote.
Right.
And I'll explain that. A young lady who get tested today, AMH is okay, uterus is fine, she's 25. I mean, and so everything concerning fertility is okay. Our assessment. And 3 years later, she gets married to a man who is azoospermic.
Right.
I mean, azoospermic man will change the dynamics of that family from. So a woman 3 years ago who is classified as being fertile suddenly becomes infertile. You know, in terms of, that's why I said in quote in the sense that is because of her partner is unable to start a family or to have the family she desire without intervention. So if such woman had done the test, yes, it's good for knowledge, but it's not a guarantee, it's not invariable that she will be able to get pregnant without any intervention. So that's a key word. It doesn't, because if in any relationship, the fertility potential or the capacity to reproduce in that relationship is the sum total of the reproductive capacity of the parties in the relationship.
Right.
So, but it's good. I would say that at any point in time that you're concerned about your fertility, you should do the test. At least AMH is not as, I would say, also in quote, it's not as invasive as doing a cavity scan, because for somebody who has not initiated sex, to do a transvaginal scan may be somehow, meaning that you may result in doing abdominal scan, which is not as accurate in terms of follicle, doing the follicle count. So AMH is just a needle prick.
Mm-hmm. Okay. And for men, they just get the sperm
Well,
analysis done.
yeah, you just get the sperm analysis. If the best way to bring out the semen is through what is advocated is through masturbation.
Right. Okay.
So, of course, there are other methods. There are non-spermicidal condoms. What it means that man must have a partner.
Right.
To be able to do every other thing apart from to be able to bring out semen through other methods apart from masturbation, then that he requires a partner.
Good to know. I just thought it was important to have to talk about that, just for people to know, for anyone listening, just wondering. And of course, you said that with freezing eggs, it's not a guarantee. And of course, there's always conversations about embryos stored or frozen is better than eggs, just because of the whole thawing process. So just for anyone wondering about that, if you're in a relationship and you're sure that that partner is someone you might want to have children in the future, is it better to freeze embryos then as opposed to eggs?
I will, if you're in a stable relationship and you're committed to having a family together in future, and if they're concerned, I would say that they should freeze embryo rather than freezing eggs, if the law of that country permits that. I know sometimes even in outside freezing discussion, sometimes it's the responsibility of the physician to also advise them that for instance, if I have a woman who is 39 and wants to freeze her egg, I would rather advise her to either attempt to get pregnant immediately rather than freezing the eggs, either through donated sperm for intrauterine insemination or IVF. Remember, like as I mentioned earlier, age is very important because we know that the quantity and the quality of eggs continue to decline as we grow older.
Right.
So what it means is that if you're freezing egg at 39, it's possible that you're freezing abnormal eggs. So why not try to attempt pregnancy if you're truly interested in having a family? It's better to just attempt pregnancy immediately rather than trying to freeze the eggs. But I mean, it's not totally ruled out for them. It's still the decision. Is the discussion that the physician should have with the patient as well.
Right. Okay. Good to know. I think again,
Yes, but to answer the question, I would rather freeze embryos instead of freezing. When the possibility is, yes. If I have to choose between freezing eggs and embryo, I would rather freeze embryo.
Right. But of course, when you're freezing embryos, you definitely want to have that conversation and sign the proper documentation for what happens.
Even with the egg freezing, because you can yes, for embryos, because there are two parties now, especially if two partners have come forward and they are not married, even when they're married, the documents should still be signed. Yes, in event of divorce, in event of death, whose property is the embryo. So that discussion that should and of course, if the finances should be also be discussed, because it's like when you store eggs, embryo, or sperm, it's like you're renting a house in a fertility clinic. So you need to pay for storage fee. Some depends on the clinic. We do annually. Some clinics they do monthly, but I think annually is is more convenient,
Yeah.
or it's for both the patient and the clinic. So just pay once and forget about it, rather than having to think of payment every month.
Every month, yes. And at the anniversary of each year, then you can decide if you want to keep storing it or how you want to proceed. Mm-hmm.
Without any calculation or trying to prorate.
Right. Okay. So, and with this freezing, either eggs, embryos, or sperm, you do that at your clinic? That service is
Yes, we
available?
do. Yes,
Okay.
we offer such services.
Okay. And people
So,
can come. Mm-hmm. Go ahead.
so we freeze eggs, embryos, sperm, so people can come from all over the world, and
Okay.
we're able to manage the logistics as well.
Okay. And like you said earlier, anyway, there's no time limit as of this time in terms of the storage. So people can have it potentially for as long as they need.
Yes, for as long as they need, and for as long as they pay the rent.
Right, of course. Yes, that's important. Yes, that is important. Okay, good to know. I think this conversation is definitely really important for us as a society and across the globe, because again, infertility is rising globally, and it's important that people know prospective options that are available. Because one of the things that I think people as they get older is things they wish they knew when they were younger. So,
and it's very important to create awareness. I think when people become aware of this, when people become aware of the fact that infertility can just creep in without knowing, that he's very still in his behavior, and that the fact that unless you get tested, you don't know where you stand. And now that we know that there's technology to preserve a kind of insurance, even though it's not foolproof. I mean, the way I see it is that the cost of not doing is a lot more than the cost of doing it, even if at the end of the day desire is not met, because cost of not doing it will come with certain regret. Cost of doing it, even when desired objectives are not met, it may mean that, okay, well, I tried my best.
exactly. Thank you, Doctor. And for anyone wanting to reach out to you and connect, or perhaps ask more information about fertility preservation, is Instagram the best way at Origene Fertility? Is that the best way to reach you or contact your clinic?
Now, Instagram is one of the ways. We have a website, originefertility.com, then our telephone numbers and our social media handle. So we can be reached, email, Instagram, telephone, and
the website.
Yes, and the website.
Okay. And as a wrap up, is there any other information that you'd like to provide today or share with us today, Doctor?
No, what I'm just going to say is that we should become very conscious of fertility and what we desire in future. If we desire to have a family in future and you are not married by the age of 30, 32, I think freezing eggs should be a serious consideration.
Right.
And likewise, for men also can become infertile later in life, maybe not necessarily being unable to impregnate a woman, but with men, miscarriage rate increases with age.
And that's important for people to know,
yes,
because people don't
yes,
know that the sperm
yes,
also impacts that.
yes. With age, virtually all the sperm parameters decline.
Wow. We definitely need awareness about that. Thank you for sharing, Doctor.
Yeah.
Thank you so much for your time today. It really has been very informative and insightful session. I think it's so important, like you rightly said, that awareness is important, because when people know, then they can make better decisions and informed decisions. So thank you for always taking the time to create awareness, to educate us, and to let people know about that fertility. It's so important. Either people choose to have children or not, it is good to know the options and then decide on how they want to proceed. So thank you so much for your time and dedication and passion.
Thank you for having me.
Thank you, sir. And we look forward to having you again in the near future for other conversations.
Sure, I'll be available anytime.
Thank you.
Thanks for joining us this week on the Fertility Conversations podcast. If you enjoyed this podcast, please give us a 5-star rating and subscribe. Follow us on Instagram at Fertility Conversations. If there are any topics you would like to have discussed, please send an email to fertilityconversations@gmail.com. Be sure to tune in next week for our next episode. Thank you again for listening. Take care of yourself and do stay hopeful.